Hello everyone, presenting a diabetic vitrectomy. In this pre-op OCT, you can see the foveal traction of the taut hyaloid with a epiretinal membrane. We start with some anterior vitrectomy and follow this with a core vitrectomy. This patient had dense astroid hyalosis, making the view of the retina pre-op a little difficult. So OCT was the only finding we had. The other half of the patient was lost to tractional detachment, and this was a one-eyed patient. After the core vitrectomy is complete, we move on to induce the PVD. So we stain the vitreous with the help of triamcinolone. We start with inducing the PVD from the disc inside out. So the central PVD is being induced. But as this was being done, I noted that the macula was being lifted along with the hyaloid, and I didn't want any de-roofing. So proceeded with small movements and inducing the PVD just around the disc and clearing the vitreous sector by sector. Post this, I moved to trimming the vitreous along this central attachment at the fovea. So going to my macular lens, lifting of the posterior hyaloid from the disc, and here you can see it is still attached to the macula. So I am trimming the posterior hyaloid along the macula and keeping a frill at the center. Once that is done, I can safely induce the PVD from the disc along the periphery. Post this, I move on to the temporal side, and from here I am just gently trying to cut the vitreous along with some vacuum, and thus I induce the PVD along the macula and separate the central fill which is attached to the fovea. Once this is done, I start inducing the PVD again, but here I notice the neovascularization front along the superior arcade, and hence I thought best to not induce PVD in that area first. So inferiorly, now I don't see much of NVs, and so I could induce PVD and completing the vitrectomy in that area. Following this, I go outside in, so gently I am inducing the PVD in small sectors, not trying to lift those NVs at the superior arcade. Once this is done, I change my hand, induce PVD from the periphery and clearing each segment of the retina. Once this is done, I move on to this area which had a lot of neovascularization. So I'm gently trying to just trim that area off from the periphery attachment of the vitreous. Once that is done, here I could achieve a complete trimming of that area, and here you can see that the PVD was complete. Once this is done, I just identify this area where there is still vitreous left, identifying the bleeders and then cauterizing the bleeders. With these beveled cutters, 25 gauge by Alcon system, we have a very good control and we can move very close to the retina, and this helps immensely during such surgeries. Now proceeding to the ILM peeling, so staining it with the brilliant blue-green dye. So this is the pinch and pull technique that I use. This is the grease shaper forceps by Alcon. So gently removing small, trying to get a flap, and this pinch and pull technique is what I prefer for ILM peeling. So once I get this flap, you can see that the hyaloid along with the ERM is being peeled here in toto. This is the flap which pulls off that central hyaloid and the epiretinal membrane, following which we complete the ILM peeling at the central posterior pole. Often restaining the area with the dye helps to peel the ILM. Once this is done, this is the only problem area now left to deal with. So clearing of the clotted blood with the help of the cutter, making sure there is no 2-point attachment of the vitreous or any membranes, so that no future traction can develop. Once the cauterization of the bleeders is done, we proceed with the pan-retinal photocoagulation, and the laser is being done 360 degrees. So this being a one-eyed patient, the tamponade of choice was a dilemma. I didn't want to keep the patient on gas or air, so I decided to go with silicone oil, as I didn't want any dispersed hemorrhage in the post-op period. This would have caused severe problems to the patient. So once the laser was done in all the areas, we finish it off with a fluid gas exchange followed by silicone oil injection. Here you can see the post-operative OCT on day 1, and you can see the relieved traction and the pull on the retina is also gone. Thank you.